start on point.
The subject of this episode's Talking Points is missed documentation, a very important topic. Medical documentation is most often referred to as the medical record. And the purpose of the medical record is multiple. Number one, to serve as the basis for planning patient care. Number two, to provide continuity in the evaluation of the patient's condition and management. Number three, document the course of the patient's medical evaluation, treatment, and change in their condition, including communication between all healthcare providers, very important, that contribute to the patient's care. And finally, number four, to assist in protecting the legal interests of the patient. We'll talk a little bit more about that further into the talking points. In short, medical records are designed to provide a medical history, determine if past treatment has been affected, to determine what other healthcare providers have done, and to protect the healthcare provider from negligence issues if the duty to protect the patient's rights has been violated. Now, as medical professionals, we might ask, how do we accomplish this? Are there standards or guidelines for medical documentation? Well, yes, there are. I did a quick Google search recently of the term medical documentation guidelines, and this yields almost 26 million hits. Most of this information describes documentation as the written account of observations, the information the patient, resident, or family relates or tells you, the data you collect during care, and the care that you provide. However, the plethora of these guidelines is both helpful as well as potentially harmful. Documentation also means to give written information that is proof or support of something that has been done or observed. Most of us have heard the saying over and over again, if you did not document it, it was not done. Now, lawyers use this tenet as the basis of many malpractice claims. They have their own literature data set. Going again to Google finds over 5 million references to medical documentation and legal issues. Accurate, timely, and complete documentation of the care we provide to our patients can provide excellent protection in the event of a claim of injury, neglect, or deviation from standard of care. As a medical expert, I've been involved in several cases, many just recently, where a single omission in the record results in acknowledgement of liability with significant financial payout. Documentation provides crucial legal protection. It is admissible in court. The patient medical record must be documented as an accurate, complete, systematic, logical, concise, and timely record. Courts will view the documentation of the medical record as proof and verification to patient care. By showing that the individual under your care received quality and adequate care, a well-documented record can and most likely will protect you legally. We know that paper charting and handwritten notes are quickly becoming obsolete. But when it comes to purchasing or implementing an electronic medical record, Talking Points encourages everyone to be informed and knowledgeable buyers. There are clearly Cadillacs as well as tricycles out there. And that's a memo.